Good morning, everyone. Welcome to another episode of As Seniors Fireside Chat. And together with me is, of course, our lead, si Levisel Kalang, and also si Sir Evan Eliazar. Good morning to all of our hosts this morning.
Good morning.
Good morning.
Aga po.
And we are very happy to have with us some guests who will be helping us understand more about vaccination, the importance of vaccination, especially because of the pandemic. Now, we are also very happy that we're able to get with the Ramon Aboitiz Foundation Incorporated.
Yes.
Lev, can you please explain their project to us?
Yes, they have a Comunidad contra COVID campaign. So this is some information, dissemination on COVID vaccination, and also with the UPMAS. We'll just do the introductions first, Sir Bob.
Yes.
Okay.
Okay. So we will be asking Dr. Myra first, right?
Good morning. So I am here. I was invited as part of the University of the Philippines Medical Alumni Society here in Cebu. So I'm an eye doctor practicing and teaching in Cebu Velez General Hospital, in the University of Cebu Medical Center, in Vicente Sotto Memorial Medical Center, and I'm also affiliated with Chong Rom Mandaue.
Some of the top medical centers in Cebu.
Mahilig po magturo. Mahilig po magturo.
And we also we have with us as well Dr. Philina Villamor. Hi, Doc.
I'm Villamor. I'm a pulmonologist by specialty. And I also teach. I'm a faculty in the Cebu Institute of Medicine. Thank you for inviting us.
Thank you, Doc, for joining us today. And we have Dr. Christine Siguan Bell. Good morning.
Hi, good morning. So I'm Dr. Christine Siguan Bell. I'm also an eye doctor, an ophthalmologist. So I'm Dr. Myra's colleague at the University of Cebu Medical Center. I also teach in the Cebu Institute of Medicine and affiliated with Vicente Sotto Memorial Medical Center and Chong Mandaue. Good morning.
Thank you, Doc, for gracing our podcast today.
Perhaps you can begin by asking, how do vaccines work? Kasi ito yung isa sa mga kinatatakutan ng mga tao kasi sabi nga nila, just like the flu, yung flu shots, na kung i-injectan ka ng flu, parang merong mga virus ba yun na para mag-aano ka, you will be able to gain somewhat like immunity from the virus that gets in you. So parang ini-injectan ka ron ng virus. What is the difference between that one and the vaccine that is being injected to prevent or to stop the spread of the COVID-19?
Okay. Vaccines po are very specific, no? For each disease, merong vaccine for that disease. So yung niro-roll out po natin ngayon, Tagalog or Bisaya ka lang. Ang gi-roll out nato karon is kanang vaccine para ra gyud sa COVID, no? Mauna ang massively gi-roll out nato karon. So how vaccines work, iyang i-jump start ang imong immune system. So that if you're ever infected po with the real virus, no? Kaya ang sulod man sa virus, ang sulod sa vaccine is inactivated or dead virus or part of the dead virus. So i-inject siya sa imong arm. If later on, you get infected with the real virus, no, so the usual respiratory manang pagsod sa virus, ma-recognize na, and then because na jumpstart na daan ng imong immune system, maka-fight na dayon. So, it's kind of like putting up a lot of wanted posters, no? Tapos pag dumating yung bagong criminal na nandyan na siya, makilala ka agad ng immune system mo, tapos fight na dayon, mao na siya.
Okay. Okay. So,
Maybe
thank you very much, Doc.
Hello? Hi.
Yes, Doc Ben.
Hello. In addition to Doc Myra, if I may, can I share pictures? Maybe
Sige,
they
Doc.
can, for illustration purposes. Can you see the screen now? Can you see the picture of the virus?
Yes.
So, ganito po ang itsura ng SARS-CoV-2 virus, no? Ito po yung causative agent na corona. So, as you can see, para po siyang Christmas ball, no? Para siyang ornament, na bilog siya na may mga spikes. Ito po yung tinatawag na spike proteins. So, kaya siya tinawag na coronavirus kasi para nga siyang may corona. So, ito po siya. So, of course, we don't see it with the naked eye. We see it only through the microscope, through an electron microscope. Napakaliit po niya. Okay? So, ito po yung structure niya. Kasi po, para maintindihan natin how the virus works, mas maganda po, maintindihan din natin anong structure ng virus. So, ito po yung structure ng virus. No? So, meron po siyang envelope. Sa loob po nun, yung genetic material niya. Okay? So, ang genetic material niya po, ito po yung ginagamit niya na mechanism para po mag-replicate. No? So, ito po yung nagko-contain ng material na kailangan para mag-replicate siya on its own sa loob po ng katawan ng tao. Okay? So, pero on its own po, in itself, hindi niya kaya mag-replicate on its own. Kaya kailangan po niya mag-invade ng katawan ng tao. Kasi kailangan po niya gamitin yung machinery ng katawan ng cells na natin para po maka-replicate siya, para dumami siya. Yung genetic material, itong blue, and then surrounded by the envelope, the membrane and the envelope, at sa labas po nun, yung tinatawag natin na spike proteins. Importante po talaga itong spike proteins kasi po, ito po talaga ang tina-target ng karamihan sa mga vaccine natin, no? Na antibody, I mean. Yung antibody, ito po yung pinoproduce ng katawan natin na reaction, yung sinabi ni Doc Mai kanina, no? Na reaction to the vaccine. So, magpo-produce po tayo ng antibody para ito po yung lalabanan, ito po yung i-attack niya ng antibody. Ito pong spike protein. Okay, so alam po natin ang transmission. So ito po, papakita ko lang yung example ng how the virus goes inside the cell. So ito po yung virus, a-attach siya sa receptors, no, sa lining ng ano natin, ng cell. Tapos papasok po siya at yung genetic material po niya mag-i-invade sa loob ng cell natin at gagamitin po niya yung mga machinery ng katawan natin para mag-replicate. So gagawa siya puporma siya ng virus sa loob. Yan, magdami siya at ilalabas niya. So in a way, ang nangyayari po, nasisira din yung cells natin dahil ginagamit nga ng virus. So ito po yung ng cell, ito po yung antibody reaction, no? So yung antibody, ito po yung lumalaban dun sa virus. Okay? So pagka po na-infect tayo ng virus, natural po na nagpo-produce tayo ng antibody para sa virus na yon. Okay? That is the natural immunity. But of course, because of that also, meron ding mga komplikasyon na pwedeng mangyari sa atin, di ba? Because of that natural infection. Okay? So kaya meron tayong ginagawang way of immunizing. Ito po yung vaccination. Na hindi tayo dadaan ng infection ng natural way, kundi makakaproduce pa rin tayo ng antibody. No? Pag inject tayo ng vaccine, makakaproduce pa rin tayo ng antibody para in case po magka-infection tayo, pwedeng labanan yung virus na pumasok. No? So ito po yung antibody, i-attack po niya yung spike proteins para hindi na siya maka-attach sa cells natin. Okay? So yun po isang way. So yung sinabi ni Doc Mai kanina, merong iba-ibang klase ng vaccine. Meron po tayong using the whole virus, okay? Or parts of the virus, okay? Yung protein nga po. Or the genetic material itself. So later on po siguro during the discussion, mas madiscuss po natin, no, yung iba't ibang klase ng vaccine available for COVID-19. So ito po yun, no? Marami kasi pinoproduce. Sa totoo lang po, there are 500 vaccine trials no ongoing, pero hindi po lahat 'yon nakakapasa into humans, no? May ilan na nakapasa into humans. Ito po yung nag-undergo ng clinical trial ngayon. So marami pong klase 'yan. Ito po nga yung sinabi namin kanina. So later on siguro mas madi-discuss po natin yung iba't ibang klase ng vaccine para sa COVID-19.
Actually, that's our next question. What are the available vaccines right now in the market, especially for the seniors?
Okay. Right now in the market, there's none. You cannot buy it in the market.
Okay.
Na makukuha lang po yung vaccine from the LGU. Okay. Because right now po, all the vaccines are under emergency use authorization because there is a pandemic. So kailangan ho natin na labanan natin yung pandemya para dili daghan magkasakit, dili daghan mamatay. So ang LGU together with the Department of Health ang ga-work ana para ma-roll out matagaan tanan og vaccine. Right now, ang available na naa sa Cebu is the Sinovac. But AstraZeneca supplies will be arriving in May. The second dose of the people who were given AstraZeneca in late March, they will be given their second doses in May. So, mao ang duha. I think in the next few weeks, we're expecting the Malaya also to arrive.
So, Doc Myra, kaning duha ka buok nato nga vaccines, para mura siya dili siya tailor-made for a specific group of people. This is already good for seniors and let's say young adults or let's say katubang mga middle-aged. Wala siya specific target.
Actually, yun nga, the vaccines are made for everyone. But as with developing man good new vaccines, usually ang study na if the vaccine works are aged 18 to 59 dayon walay sakit, no? So but the vaccines are made to work for everyone. Sa karon lang na medyo nihit man good ang vaccine, no? The global supply is not good now, especially diri sa Pilipinas, it's not good. We have to prioritize the giving of the vaccine to the people most at risk of getting severe disease. Mao lang na giuna nato ang mga healthcare workers, no? Sila ang naa sa A1 group kay sila man ang pinaka-exposed, and then yun nga lisod kayo kung magkasakit ang healthcare workers. The next group is A2, the senior citizens. And the third group are A3, not senior citizens, younger, but with comorbids like high blood, kidney disease, diabetes, asthma, and so on and so forth. So, ang mga senior man good og masakiton, sila ang pinaka at risk na pag natamaan ng COVID, medyo lisod-lisod, tingalig manginahanglan ma-ospital or worse, no, ang mahitabo.
I see.
If you are senior, and then napag your health issues, kamo gyud ang pinaka at risk and pinaka dapat nga maunang mabigyan ng vaccine. Kasi even if your health issues are controlled, let's say po yung hypertension ninyo, your heart disease, your diabetes is controlled, COVID is one thing that can push you over the edge, no? Na maguba gyud tanan, no? Okay, unta ka, you were doing well with your medications, but kung maigo ka sa COVID, you are the person who is not likely to do well compared to a young person, let's say a 25-year-old, non-smoker, not hypertensive, not diabetic. That person is more likely to do well compared to a senior citizen na naay sakit. Mao very important po na magpabakuna mo dayon. I will share lang po, my mother is 81 years old, hypertensive with asthma. Ako, gyud siyang gidali-dali po na pabakuna as soon as I heard that it became available. So I followed the procedure po na i-register daan sa Cebu City, no, where we're from. And then yun, we went to the vaccination center as soon as we heard that they were accepting patients. senior citizens.
I'd like to
Yeah.
follow up on that one, Doc Myra. Kay akong mama is 84. And then 84, niya, napod siya blood, and she's a cancer survivor as well. But she's very concerned. Kapila namin niya gastorya nga, mang, pa-register na lagita sa itong barangay hall para ma-schedule na ka. Dili siya ganahan, kaya hadlok siya. Mo yung siya nga, di naman ko pwede, kay senior citizen naman ko. Kapila mi gasigigon sa niya, explain nga, kinahanglan yun, kaya ikaw may vulnerable niya. Napakay mga apo, nga tigbisita nimo. O niya, pagkahuman sila, bata, basig dili kayo sila affected, dili kayo vulnerable, ikaw mas vulnerable. They might carry something that we do not know. How will you be able to protect yourself? So, maghilom-hilom, magbugot-mugot pa siya, pero we want to, di lang namo ang pugos dayon. How would we convince our parent who has that mentality?
What is the alternative po? So usually mauna ang among sige, Dr. Villamor might have something to say po. But yeah.
Yeah, I think they're very concerned about the safety. So the assurance we want to give the general public, ang among assurance gusto ganahan ipa sa tanan, no, na safe gyud, generally safe gyud ang mga vaccines na to. Okay? The only contraindication, ang bawal lang gyud, no, na only contraindication is a severe allergic reaction. Kanang anaphylactic reaction, kanang maglisod na kaginhawa tungod sa reaction sa bakuna na mahitabo na siya na 1 in several millions. Ing ana gyud siya ka-rare na event niya. Usually naay profile mga naay kanang grabe na allergy in history, kaya mo screen ta sa mga pasyente. Pag-abot dito sa site, actually naami screening, hindi man dali vaccine dayon, no. Mag-check mi sa pasyente, mag-interview, mag-check mi kung unsa gid ang mga sakit nila, unsay mga tambal lagi pang take, nagkasakit ba siya recently, whatever, no. Mga ing-anang history, i-check namo ang pasyente niya, magkuha pa mi blood pressure, mga ing-ana. So i-monitor po namo ang pasyente, no. So naatay safety measures, no, to really check na okay ra ang atong pasyente makadawat og vaccine, and after the vaccination i-monitor pa namo sila, no, 30 minutes to 1 hour depende sa case, no. So to check just to make sure na okay ra gyud ang atong patient, no. So the vaccine is generally safe, o kanang during the vaccination itself na ami safety measures to make sure na okay ra gyud ang atong pasyente. So kana among assurance sa mahatag sa atong mga patients. Daghan na god na vaccine ang mga pasyente. Of course, dita ka-force, no. Naagyud, lisod gyud mag-convince, no. Personally, akong mga kailapod, no, na akong mga relatives, no, na asa dili ganahan magpa-vaccine, di na ako sila mapugos, no. It's still a personal choice. Explain na tarong, nakahatag right information, then makahimo na sila decision by themselves kung unsa gyud ang ilahang gusto for themselves.
Mao.
Doc May, thank you.
Yeah.
Lang ko i-share siguro what is different from my experience with my parents, no, compared to Doc Myra. So ang akong parents, ang duha senior citizen na gyud. They are both 66 years old. So siguro nga akong ma-share kay ang akong mama nakakumpleto na siya sa duha ka dose nga Sinovac. Usa siya sa mga nauna sa Sinovac kay senior citizen man gud akong mama. She is 66. Ka-practice gyapon siya as a family med physician. So pag-abot sa vaccine, katong nga time na apay istorya nga dili pwede kunuhay, dili man sa dili pwede, wala pa nila hatag or ang Sinovac sa mga senior citizen pag-abot diri sa Cebu. Ako mama, siya mismo nag-ingon ako nga nganong maghulat pa man siya sa sunod nga vaccine nga unyag ma-COVID siya, mas lisod na hinuon, usa pa mas dako og gasto, mao jay problema diri sa ato dako gasto, di ka katrabaho kay quarantine ka. So ang experience ako ma'am sa duha ka vaccine, buyag, no? First, sa tinud-anay, medyo ang iyahang kamot, hibugat ni laylay sa pirmirong injection. Pero wala gyud siya gipamati nga hilanat, sipon. Ang akong mama ginabaksin man na siya kada tuig og flu vaccine. Ambot kung kasagaran naka-experience man na ng flu vaccine. Sige pa una niya kada adlaw, kumusta man ka ma, kumusta man ka, kumusta. Laylay lang ang kamot, wala siya gihilantan, wala gyud. Ako mama high blood po ni siya, high blood na siya maintenance. Pag abot gani namo dito kay sa hospital man jud i-vaccine, dito siya gi-vaccine sa Velez Hospital. Dugay kay siya vaccine sir kay ang iyang blood pressure di gyud mo us-us. Nagsugod 150 over 90. Kulbaan man siya kay sayos buntag human pahuway sa dok. Yeah, after 10 minutes pag BP uy nisaka naman hinuog samot 160 over 90. Insya nagsige na magkasaka di naman siguro ko ma-vaccine ani niya ang kasagaran blood pressure sa mama 130 over 90, 120 over 80. Di pa pahulay gid siya siguro mga 30 minutes niya ingon siya i-BP ko pero kanang dili daghan ang gatan-aw nako kay nakulbaan ko. Insya ayaw kunin yung tapuki. Pag BP sa iyahan nahimog 130 over 80. Human gi-vaccine
psychological effect.
Nakulbaan po siya, doktora na ni akong mama ha, kabalo siya nga importante ang vaccine. Pero kani akong istorya kay kung naatay mga senior citizen diri, ganahan ko makadungog sila sa kanang pirmiro yun na vaccine, hantod sa nakakumpleto sa vaccine, hantod sa nakahuman na siya sa 2 weeks, nga mauigi paabot nato nga gikan sa second dose nga 2 weeks, nga makaingon ka nga na kay antibodies, no, basin sa mga studies. So, ako mama na kompleto na niya tanan, hantod naka 2 weeks, unsa naman siya, 18 days na siya gikan sa iyang second dose na Sinovac. So, naa siya kakulba. Pag injection, gikuyugan man ako siya, nya ingon siya, giinitan ko niya. Unsa man, paduol ta sa electric fan ma, duol sa electric fan. Gi-BP na sad siya, saka na pud iyang BP, kulbaan na pud. Ingon na gud ko hapit sa ning BP. Ako na lay mo BP sa akong mama. Kay murag na kulbaan siya ni mo. Sir, nurse man na ang mo BP or ang atong mga barangay health worker or mga volunteers, no? So, pagyaman, sige lang, pahuway lang dok. Ano ya? Pag taod-taod, BP na pud, ni ubos-ubos na. Pagsunod, BP na pod, nisaka na pod. Nya, naghulat jud mi dito 1 hour. Dili siya, naman ko'y uban mo istorya no nga. Pagka mag-vaccine 15 minutos ra ko dito, uli na ko. 30 minutos, uli na. So naadyo'y uban nga, maghulat gyud og 1 hour, kay tinuod man ang kakulba, especially sa senior citizen, nga naa na jud tay mga gipamati, no? Pero nakauli siya, pag uli niya sa mga sunod na adlaw, sige jud taon siyang atang kung hilantan ba siya or unsa kay mao may istorya lagi. Pero wala gyud buyag, wala siya gipamati. Human, let's go to the second dose which is nakuha sa akong mama 4 weeks gikan sa first dose. Sa second dose niya, ang iyang experience, wa na kay siya gi-high blood. Kay wa naman siya kulbait, kabalo naman siya unsay mahitabo. Pero ang iya pong na-feel, kay pagkahuman jud kunog injection, laylay dayon iyang kamot. So sa permiro man gud ni laylay lang siya pagkasunod adlaw na, pero pagka ikaduha, pagkahumag injection iyang paminaw, laylay dayon, mag 1 hour pa lang ni laylay na. Pero ang mga sumunod na adlaw ana, wa gyud siya gipamati, pero wa gyud niya giundang ang iyang mga maintenance, padayon jud tanan. Kay ila man jud kang pangutanon unsay maintenance nila. So siguro kana lang sa akong ma-share kay ako mama na complete man niya na ang duha ka doses, nakahuman na siya sa 14 days, makatubag sad ko og kanang naay comorbidity kay high blood man siya niya. Maunay iyahang gipamati.
Duha na to ka vaccine ning AstraZeneca o kaning Sinovac. Do they require 2 doses both?
At this time po, except for the Johnson & Johnson vaccine, all the vaccines require 2 doses.
I see. I see.
But later on, baka mag-change yung recommendation po for the Janssen vaccine. Baka kailanganin din ng second dose. But right now, yan, most po, except for that one exception, 2 doses yun.
And the standard waiting period for the second dose is after how many weeks?
Magbago, depende po sa brand. So, paano man, ang recommendations of that particular vaccine ang gisunod. So, that's why yung Sinovac, gihatag po after a month. And then, ang AstraZeneca, pwede man 12 weeks.
I see. I see.
Dr. Janice Lim of Chong
Hi.
Hospital is also here. Good morning, Doc.
Hello. Hello. There was a question. I noticed that there was a question. So I would just like to share my experience. No? Kaya nag-volunteer man ko sa vaccination centers like Robinsons and Chonghua. So, well, dili gid siya required. No? A medical clearance is not required para ma-vaccinate. Dili kinahanglan. Pero makatabang jud kung naa sila dala nga clearance kay madali ang isa ka process nga mapadali siya ba. So but definitely namatay doctors dito nga mo screening, no, mo screen kung ano gud sa gibati, unsa iyang unsay mga diseases, no, unsay iyang maintenance medications. Usually naagid na siya mo evaluate sa atong population, no, atong mga seniors. So naabigyan mo evaluate before sila i-proceed into vaccination, no? And after that also, naamag yun mo monitor also. They will not be allowed to go home nga dili sila i-monitor. So if ever nga mao na ilang concern, no? As for the clearance, okay. In my experience, mo share lang ko ha, in my own experience ha, most of the people that I saw there actually out of like, let's say, out of 10, no? So only 1 or 2 maybe nagdala og clearance, no? And for those nga nagdala og clearance, ang nagdala sila prescription, a list of their medications, pas-pas kayo ang process because every time we ask them like, unsa man yung maintenance medications, doc nara o. So ipakita na, so more or less makabaw na ka kung unsa iyang comorbidities, no? So it helps a lot, faster jud, no? And also, there's also, what I noticed, this is true sa Robinsons, no? Sa Robinsons Galleria nga vaccination. What's true is, kanang, those outside, katong naa sa gawas nga screen, usually ipalista na nila sa mga patients ang ilang mga maintenance medications. So pag abot sa amo, yung unsa man imong maintenance, naa na dito, doc, akong gisuwat diha sa likod. So it makes it so much faster, no? If that's the question. Dili siya required but makatabang siya para mapapaspas, no? Especially those nga naailain diseases, no? Pero for those autoimmune nga they autoimmune like lupus or mga autoimmune diseases, no? Those or undergoing chemotherapy, cancer patients, it would be good if they have a certificate or a note lang, even a note lang from their doctors nga kuan sila ba kana they are fit to have the vaccine or fit to be vaccinated. It will really help actually, no? That's
Yes. So, like, yun nga,
Thank you, Doc. Yes.
mentioned by Dr. Villamor and Dr. Lim, na mag-yu screening process. So, check yun ka, pero makabantay yun mi na if you're registered daan with the LGU, if you have a certificate from your doctor, makapaspas yun siya sa process. Strictly speaking, ang manginahanglan lang o medical clearance is those with autoimmune diseases, HIV, cancer patients, undergoing chemotherapy, kana siya. So, kung dugay na ka na-treat anang mga sakit and your immune system is okay raman, you don't need medical clearance. It just makes the thing faster.
Okay. May I just ask, because a senior right now has prioritized the concerns of the senior community. So in that sense, nakatutok po kami dun sa ano na yun, major group. However, I understand that the vaccine addresses or will help across yung generations, regardless of age. Yung tanong ko po, bale, wala ba talagang walang negative interaction yung bakuna dun sa mga senior citizens natin na maraming iniinom or may iniinom na mga yung maintenance medication. And second question, considering that we are receiving various informations and regarding the vaccine or vaccination, yung iba parang nagkaroon na siya ng mindset na kapag nabakunahan, safe na ako. So hindi na siya nag-iingat yung dati masyadong concerned regarding yung pag-follow sa protocol, ngayon parang hindi na masyado sumusunod. So what are the things that those na mga nabakunahan na so should be aware of? So 2 questions po.
Information kasi, yun nga, this is very important that kitang tanan, we always find out asa gikan yung information. Even from friends, di ba? Kaya naman yun na yung mga chat group, yun. We really ask each other, asa na nimo nakuha? So usually, if naay kauban na link, na okay, you can confirm this information by looking at this study or looking at this news article. So na siya. Ang reliable yun na information po is galing Department of Health. I will say that if you can trace the information back to the Department of Health, that would be good. The Department of Health has been working tirelessly to try to combat misinformation. So na gani na ay Facebook site ang Department of Health, na ay DOH, Viber group. You can also confirm your information from a doctor. Ayaw ka ng lang. Ayaw ng rinig-rinig lang. In terms of effects po, okay, tanan namong pasyente na tagaan og bakuna, amo magyuing na you may experience effects. And the most common effects po na maramdaman ninyo are flu-like symptoms. No, pwedeng maghilanat, pwedeng magsakit-sakit ang lawas, no. In general, dili ka ubhon kay wa man kay real good na infection, no. Ang bakuna ni agi man siya diri, but you might feel na medyo bugat-bugat ang lawas, bugat ang kamot. Now, I will say sa mga kakilala po namin, it's more of the younger people who actually experience those symptoms. But we warn everyone that you may experience those symptoms, and if you do, you can always take paracetamol for the time po na naakay gibati. And then before you go home from the vaccination center, tagaan man kag vaccination card, nakasuwat man sa dito ang hotline na pwede nimong tawagan kung naakay gibati. And one more thing, no, that's very good for us here in Cebu, our medical system is not yet as overwhelmed as NCR. So kung wala kay salig sa hotline and you want to go to a local emergency room, okay ra gyud kaayo, madawat pa ka. No? So ayaw kahadlok sa side effect kay pareho sa giingon ni Dr. Villamor kanina, gamay ra kayo. So kung i-compute 0.0000, daghan kayo decimal, daghan kay zeros after the decimal point ba, gamay kayo yung porsyento. Na siya.
If I may add, okay lang?
Yes po.
May I add something?
Yes po.
It's the fear that we have. Ang experience po nako ang ilang fear ba is actually very real, you know. Actually, mutana sila nga, this is my personal experience lang when they ask me, Doc, kung magpa-vaccine ba ko, Doc, kanang, Doc, makamatay man ko ng vaccine, Doc. Okay? So, there are also questions. This is real. Gahapon lang ni, the other day lang ni, Doc, ingon sila, Doc, ma-zombie man ko na, Doc. That extreme, yes. Doc, ma-zombie man ko na, Doc. And then there are those also nga, Doc, katulagi among Doc, katong kaila sa unsa, Doc, kataga unsa, Doc, kataga talisay, Doc, human sa ikaduhang nga vaccine, Doc, namatay. There's a lot of reference for that Talisay patient actually, no? So, but I don't know about that patient. So, actually, what they hear is a lot. They read a lot from social media. Kasagara gid nga makita na social media. We cannot deny the fact man good nga kanang information dissemination from the DOH. Gamay ra gid kay siya compared to the other information or false information that's spreading through the internet. So mas dali gid siya mo pop up, no? Oh, namatay sa vaccine, naunsa sa vaccine, whatever. So mao gina, and for them actually honestly they wouldn't know kung unsay legitimate or not, no? My parents for example, uy nako ni kuan ana, so they will always ask me like, uy kani kuan lagi nalagi ingon ani, uy kanang nalagi ingon ani, no? So since it comes out in the internet, they assume that it is true, no? So actually, mona siya, that there comes actually the role of those who know, like yourself, and also us, no? When we talk to people or the patients, to try to educate a little lang yun, and hopefully, katong ma-educate mo, mutaba o educate sa lain, para that's a very, very common question.
I would like to connect with that issue regarding dyan sa Visayas or sa Cebu in particular, hindi pa overwhelmed yung mga hospitals and probably even yung pag-distribute or yung rollout ng vaccine, not as much issue compared to Metro Manila. May tatanong lang po ako kasi I think the bottom line here, you can correct me if I'm wrong, is really building the immune system of each and every one of us para may panlaban talaga. Ano po yung pwede niyong ibahagi na yung tipong home level lang, yung pwedeng merong gagawin itong ating mga kapwa Pilipino na remedies, like in my case, na pag-alaman ko na okay pala yung pag umiinom tayo nung katas ng talbos ng kamote, things like that. Ano yung pwede nilang recourse, no? Yung mga walang masyadong means dun sa pagbili ng mga vitamins, yung mga rich in zinc or things like that. Ano po yung inyo marirecommend?
To boost our immune system, the basic way is for us to have, simple lang po, no? Observe healthy lifestyle. So, kailangan saktong tulog, saktong kain, if na kay sakit, control imong sakit. If sa panilinan, diabetic ka, control imong sugar, high blood ka, control imong BP, so regular consult ka sa imong doktor. And iwas bisyo, including sigarilyo, sige inom alcohol, kana, iwas bisyo. So those are the basic things we can do para ma-boost atong immune system. In fact, we don't need to take the vitamins po. And kung sakto ra imong balance imong diet, no? Kasi the vitamins that we need in our body in minute amounts raman na. Makuha raman na sa atong kaon, sa utan, sa veg, sa fruits, no? So makuha ra gud sa atong regular diet ang vitamins that we need in our body. Unless naakay vitamin deficiency, no? Naakay sakit na maka-cause og vitamin deficiency, kana agyud ang time na kailangan ka mo supplement og vitamin sa imong lawas. Okay? So ang basic lang good, observe, and of course the health protocols to protect ourselves from getting infected, no? Kay bawo naman tatanan ana, no? Wearing mask, face shield, dili enough na mask ra good, face shield when you go out, especially og frequent hand washing, og palayo distancing, no? Especially kung naay gibati. Okay? So kana siya. Very simple lang good. Oo. Pero ako gustong i-mention, maybe our other doctors can add to that, no? What I wanted to say kanina, bahin sa kanang misinformation, no? Please do not jump into conclusions, okay? Kana gyud ang makapatay nato ang jumping into conclusion, no? Na vaccinate ka nya after 2 days na ay nahitabo na matay, i-connect dayon, okay? Dili gyud ding ana, no? We do this with investigation through a scientific process, no? To establish na naay kanang adverse effect na tungod something na atong for example, ang vaccine, no? Kung tungod na siya sa vaccine, kailangan gyud nato imbestigahan, okay? Kailangan ta makuha more information, nya. Ano na to siya, it's something that we study, okay? In fact, sa mga clinical trial na ongoing karon for vaccine, very strict na siya, no? Di gyud ka diretso makaingon na namatay gyud ka tungod vaccine, okay? For example, na vaccine ka, after that simbako, naligsan ka, mo jump ito conclusion ka na naligsan ka tungod na bakunahan. It's like something like that when you jump into conclusion. So you cannot do that. That is very dangerous. Okay? So if naakay ma-hear na news na nahitabo after vaccine, please investigate first. No, we should inquire from the authorities. No, kinsa namang authority mention ni Doc Myra ganiha, no, our health authorities, no, the medical doctors, the scientists who studies kay daghan gyud na grupo na siya, no, data management, the safety committee, no, na nagmonitor ana. It's a group of specialists, scientists and doctors who really studies this very well. Okay, kana lang ako gustong i-share na about the misinformation. Kay pandemic po ang misinformation. Duhang atong pandemic, COVID, misinformation pandemic.
That's true.
That's true po. Opo.
If I may add lang.
Sige po.
Doc
Ang
Mike.
giingon ni, maganda yung example nga kung naligsan ka, no, imo da yung ingnon na tungod kay nabakunahan. I give that example. Kung maligsan ka, ang unang makasabaan or ma-praise or whatever ang nakaligis, di ba? But there might be other reasons. Like for example, wala ko ni gamit sa proper na crosswalk or sa fly or kanang sa taas, kanang dapat mo labang ka sa taas sa flyover, wala di ay ko nagamit na naman diha. Wala ko ni gamit sa footbridge. Wala ko ni tan-aw both sides before ko ni cross the street. Natapilok ko. No, mao di ay ko naigo sa oncoming vehicle. Nakainom ko. Mao di ay dili nindot akong paglakaw. So there are many reasons. Gistudyohan gyud nagmaayo. So we cannot jump to conclusions lagi.
True. Yung correlation ng mga possible factors that have contributed to what happened or yung effect. So meron akong, baka matawa po kayo doon sa tanong ko, kasi one friend of mine, dahil dito sa ivermectin craze, nagkakaubusan, and nung unang nalaman namin yan that Dr. Landrito was making it available, so nagbilihan, so naubusan, and then dumiting ito mga binibenta using yung online shopping facilities like Shopee. Sabi natin baka hindi reliable kasi marami nga dyan fly by night and things like that. Now, may tanong po ako regarding, I understand that ivermectin was originally used for hayop, so veterinary, animal grade. Ngayon nagkaubusan, yung isang friend sabi niya, mabuti na kasi yung meron kang reserba kapag may naramdaman ka o nag-present na yung mga symptoms, sabi niya, bumili ako ng yung sachet na panghayop, sabi niya gano'n. And we even discussed yung preparation. Sabi ko, paano i-prepare yan? Kasi the one that I saw, yung capsule version, yung pang-tao, sabi ko, syempre, lulunukin mo lang, inom ka ng with water. So, ang tanong ko po, okay ba yon? Is it safe and wala bang issues doon? Kung sakaling hindi ka pa nabakunahan at gusto mong mag-self-medicate, bumili ka na lang nung animal grade, tawag dyan, ivermectin. Pwede po ba yun? Is it ridiculous?
Sige. Pen might want to take. Yes.
Doc Mai, can I say about
yes,
that?
please.
Ivermectin. So, kaning ivermectin, it came into popularity because of some studies na nigawas na siya effect against the virus. But these studies are in vitro. Meaning to say, sa test tubes, sa gyud, kanang sa laboratory na ba, dili gyud sa tao. So, as to the effect niya sa virus na naagyod sa sud sa lawas sa tao, at kaibaw. In fact, studies are still ongoing. And we have to balance that against the possible adverse effects nga po, di ba? Okay? So, we know that ivermectin is a medicine, tama po kayo, it's a medicine used for animals to combat parasites, So, kani siya naman good siya neurologic complications. So, established na gid na pwede siya makakause og mga komplikasyon sa utok, sa brain. So, in fact, we had a patient, na nag-take og tulo ka piraso ivermectin because of niya sa silingan or whatever, na to protect himself as prevention, no? So kana after that nag-ano good siya, nagkaroon ng neurologic complication, nadagit sa ospital, no? Found out nagkaroon siya ng some form of stroke, no? So in other words, di good hindi nato ano atong self ba, it's always risk versus benefit. We cannot risk ourselves, no, just because to get a possible benefit na hindi naman established. Okay, we're risking ourselves to adverse effect to achieve something na di pa sure. Okay, so kana akong take about ivermectin. Okay, so lisod gyud siya. I have a situation na ako'y kaila na nangutana siya nako kung okay na ba daw i-hold ang iyahang tambal para sa iyang kasing-kasing kay nag-take siyang ivermectin kay nakuyawan siya basig magka-interaction, no? Kana delikado na, okay, na i-hold nimo ang essential medicine just because gusto ka mo take na something na di pa gyud established, okay? That is a dangerous practice, no? Kaya ma-wonder bitaw ta nang ngano ging ani gyud ang attitude nato, no, na willing gyud ta mo take na something na di gyud established pa, na di pa ta kay baon sa gyud ang benepisyo sa atuha, okay? Whereas ang atong mga tambal na dapat nato i-take, di nato i-take, okay? And same goes with the vaccine, makonect na ko. Ngano natay apprehensions of getting something na grabe ang benefit, no? The benefit really far outweighs the risk, no? Ngano natay apprehensions ana. Whereas in a medicine at what I sure kung usa gyud ang benepisyo sa ato, willing gyud ta mo take na nag-hoarding gyud tag tambal ana, no? So kana gyud question also in my mind, ngano ging ana ang attitude nato, no? So yeah, so I hope we can correct that.
Most patients man na maigo sa COVID, kadaghanan man mag-ayo. Bisag walay special na tambal, walay special na antibiotic. As mentioned by some, no, yun nga, it's kind of similar to a flu. Yun nga, you have an immune system that will fight off the infection. So for most patients, mag-ayo yun na siya. Pero we cannot attribute yung pag-ayo na to vitamins or to even to certain medications like ivermectin that haven't been really studied well. Mauna siya. Wants to look it up, there is the thing called the PSMID, PSMID living guidelines. Nakabutang dito kung unsay mga recommended and not recommended.
Okay. Thanks, Doc. My question diri nga, if I had, okay, kung ang tao daw ko no, nagka-COVID-19 na, then of course, naka-survive and all, do I still need the vaccine?
Yes.
Definitely yes.
Yes, definitely yes. Ang studies man good have been showing that your natural immunity after a natural infection may wane over time. No? So it's still best to get vaccinated as soon as you recover, because there will be variants later on that may cause another infection.
Okay.
Okay.
Okay, Sir Bob, any? I'm just reading some. Okay. Now, where? Okay, so you mentioned earlier, where do we go daw kuno to get vaccinated? Like they need to coordinate with their LGUs, or as I guess.
Yes, kailangan i-coordinate sa LGU. The LGU will have a master list, no? And then lahi man gud ang vaccination centers sa Cebu City, sa Mandaue, sa Lapu-Lapu, and the other places. So sometimes also na the vaccination center may close kung mahutdan og bakuna. So ideally, you coordinate with your LGU. Ang LGU ang maghatag nimo og schedule kung kano sa ka mabakunahan.
Lev, in our case here in Pagadian, we are supposed to go to our barangay center to have ourselves enlisted. Na ay information dissemination nga tuyok-tuyok sa mong barangay na we have to register if senior citizens, kinahanglan magpa-register na at this point in time. If you have comorbidities, ano imong schedule so that you could already be enlisted. Kaya ang sulti nila, which is also a very good way of somehow encouraging, motivating the people to get enlisted, kay kung dili sila magpalista, unya kung maabot sila sa ilang panahon for vaccination, unya mo back out sila, they will not be given their slot anymore. They will have to wait again for all of those who have already enlisted ahead of time before they will be given a chance. So murag mo na penalty if you do not attend to your schedule.
Registered, no, you're waiting. Try to stay as healthy as possible. Yun nga, yung mga maintenance medication ninyo, huwag niyong itigil. Kailangan ituloy-tuloy talaga. Para pagdating sa vaccination center later on, dili mag-spike imong BP, control imong sugar, dili ka hilo-hilo doon.
Yung halimbawa kaka-shot lang ng kaka-receive lang ng yung flu vaccine, okay lang ba 'yon? Tas yung pagitan ng time after na bakunahan sa flu, ito nagpa-antay COVID vaccine, walang 'yon, walang problema.
Okay lang naman po.
Okay lang po.
Recommended 2 weeks yung interval, and it's not for effectivity purposes. It's more of para you don't blame one vaccine kung may maramdaman ka.
Opo.
I think that's another question. There's another question
2
which many
weeks ang interval na recommendation.
Thank you.
Now, 2 weeks apart.
I think another question which many are curious to know about, if for example, isa ka book brand ang natusok sa imuha on your first dose, is it possible nga laing brand ang pwede itusok nimo sa imuhang second dose, or should it be the same brand for both doses?
The same brand po. The same brand. We cannot reach the published effectivity if dili same brand ang gamiton.
I see.
Yeah, because we don't have enough information po as to how our body will react if we use another, I guess it's more of the it's the platform, no? Kasi laing brand, laing platform. So we don't know how our body will react to it. So wala pa recommendation, Ana, about receiving another type or platform of vaccine, or in other words, another brand.
Yes. I see.
Right. Okay. Napa ba tayo mga questions?
Siguro pahabol lang. So ano yung general message natin mga doctors po sa ating mga kababayan? Kasi yung iba talagang conservative pa yung kanilang mindset, ayaw pa. Parang nagwi-wait and see. So is it tama ba na yung take ko dito, yung get whatever vaccine is available in front of you? Ganun po ba? Huwag na tayo mag-antay kasi dati parang dina-downplay si Sinovac, mas maganda si Brand X, yung ganun. So ano po yung natin? Get what's available, tama po ba?
Baka isa-isa kaming gustong magbigay po ng take home no? But ako, I will agree. You never know po kasi when you will get hit no? With that real virus. So it's better to get protected as early as you can. Maybe the other doctors po may take home din sila na message.
I agree with I agree with Doc Myra. Yeah, if I may share a picture, okay lang po.
Okay. Yes, Doc.
This is me.
Yeah.
I just want to share it to everybody, no? It's a vaccination against COVID is a protection we can afford ourselves and our loved ones. Okay, so because hindi na tayo, it's a shared responsibility of each and every individual, okay, in our country towards herd immunity that is protecting the larger population. Okay, so ito po ay responsibility natin isa-isa. Okay, and it's also a way of showing our love, okay, for our fellow men. So please have yourself vaccinated. Consider yourself having vaccinated. Yun lang po. Thank you.
Thank you.
Salamat po.
Siguro ako on my end, what I want to share to the general public is that we have to choose the information that we want to believe in. Piliun gyud og maayo o unsay kinahanglan na tuuhan nato, no? Daghan na kaayog studies bahin sa advantages sa mga pag-vaccinate compared sa mga tinuhuan or mga nadunggan nato sa atong silingan, mabasa nato sa social media nga mauni atong imnon, mauni atong buhaton para malikayan ang mga sakit. So importante po dili lang sa senior citizen but also the younger generation to encourage their parents, their lolo, their lolas to give them the correct information. Dili pud mo mag-apil-apil og sige pud mo forward, forward ninyo inyong grandparents og mga anak abi ninyo joke, but sa ila gyud na they will believe it. Okay, of course in their generation, kung wala kaayo ng mga scientific clinical trials, they are not used to that, they will not believe that. What they will believe is what their family experienced, what their grandparents experienced, their parents experienced, what their neighbors have experienced. So I think we have to be very careful. Let us help one another in sharing the correct information, especially regarding the vaccines.
Ako lang naman, what I always tell people also, including my friends, is that first is whatever you receive on the internet, on social media, do not believe everything. That's all. Do not believe everything. Confirm first. Always get that shot. So number two, if you have questions regarding the vaccinations, no, just remember that all of the vaccines that's being released to us, no, tanan nga vaccines nga gihatag sa ato, there are already they passed the kind of safety protocols, no. So tanan na siya, di na siya ma-approve sa atong DOH, di na siya ma-approve sa FDA, kung hindi na safe, no. So, whatever vaccine that we have, so vaccine na i-offers ato at this time, take it. No? So, it's better, it's important na ma-protect sila, our seniors, us, ourselves, ma-protect during this time, instead of waiting for a better vaccine, no? Anything can happen between now and the time a better vaccine comes in, no? So anything can happen good, no? So, take that vaccine. It's safe. Regarding naman the effectivity that they're talking about, it's a common question, Doc. Ang sa Edovac, 50-50 raman ko na Doc. Meaning, pwede gapon ka mo hospital. That's always a very common question. I don't understand it very well, but the 50-50 is just the mild symptoms. No? The important is actually that it prevents 90+% of the severe disease. In other words, i-simplify lang ako sila so they can understand better. Ma'am, ang vaccine lang is para, it will prevent you, pwede ka na mag-mild symptoms, pero ang importante sa vaccine is ma-prevent nga ma-hospital ka, di ba? Di ka gusto ma-hospital, di ba? So that's the easiest way that I can explain that. Di ka gusto ma-hospital, di ba? Maunang trabaho sa vaccine to prevent hospitalizations. Hospitalizations from COVID, no? As much as we can, no? And also, there's still a lot of there's still a lot of apprehensions regarding the fear ba kung ano din sila magpa-vaccine, no? One thing is I always ask them, unsa man gyud ang ilang kahadlokan? Mahadlok ba sa side effect? Or mahadlok sa pusok mismo? Very often mahadlok sa pusok mismo. So I'll tell them, don't worry, gamay ang needle, bago per me ang needle, dili di sakit kay bago siya per me and hait kay needle sa feel, no? Funny, but it's true, no? Mahadlok sa pusok mismo, no? I thought like, sometimes explain na kaya ko ba? I thought hadlok sa side effect or whatever, hadlok na sa pusok mismo. So anyway, I always ask them, what is it that you are afraid of? Is it hadlok ka sa pusok, sa injection mismo, or mahadlok ka sa side effects, no? Then that way, if they answer me, have looked sa whatever, then I can direct my answer sa kung sa ilang fear, no? I try to address the fear that we have. So in a way, mo na siya, take the vaccine, whatever's offered to you, take it. It's safe. It passed the safety protocols given by the FDA and DOH. It has a very good prevention for severe disease. Ang atong gusto is it should prevent hospitalization. Gusto nato nga when this pandemic is over, kompleto ta. Thank you.
Salamat, Doc.
Thank you.
Thank you.
Salamat.
Okay, it seems as if time really flies very fast. Ang dami nating natutunan this morning. I'm sorry. Parang I'm very happy that we are able to tackle this topic because we were also able to answer many questions that have been playing around in our minds for the last how many months. Now, we would also like to thank the Ramon
Aboitiz Foundation Incorporated. Yes.
Thank you, RAFI,
for giving us for their project, which is entitled Comunidad Contra COVID.
Okay. And the UP Medical Alumni Society, Cebu Chapter, salamat kayo.
Salamat po.
And all our medical resource speakers with us today, salamat kayo.
And
Thank
so,
you for having us.
this is another episode of Asingers Fireside Chats, where we bring you conversations and stories that cater to older adults and seniors in our communities. On behalf of the members of the Asinger team, this is your host, Bobby Ancheta, and we also have with us,
This is Lev.
and Sir Guy. And thank you very much for joining us.
All right.
We hope that you will join us again in our future episodes. Goodbye.
Thank you. See you everyone again.
God bless. Salamat po.